Hello, this is a 34 years old lady. She's suffering from a chronic progressive lipedema since puberty. She presented with bilateral enlargement of the arms and lower limbs, accompanied by discomfort and heaviness and frequent bruising. This patient actually, despite the conservative management, it's only yielded limited success for this patient. Lymphocytography showed that radiotracer progression in the lower limbs and as well as abnormal lymphatic vessels in the right limb. So the problem list for this patient, she's a 34 years old female with chronic lipedema. She has a bilateral heaviness of the lower limbs and as well as the upper limbs, pronounced with especially in the thighs and knees. She's having history of discomfort, limb heaviness, and spontaneous bruising. She had previously conservative management with limited success. Lymphocytography showed that radiotracer progression and collateral lymphatic vessels. How would you approach this case? A. Thompson-assisted lipectomy, or B. Debulking surgery. The correct answer is option A, Thompson suction-assisted lipectomy.
The correct option here is A, suction-assisted lipectomy. First, I would like to congratulate the authors for this paper for the meticulous approach that they presented the patient with, and this is the same way that I will deal with the patient. First, meticulous assessment of the patient, not only clinically, but also radiologically with means of lymphocytography is essential, as the evidence related to the lymphatic abnormalities associated with lipedema is really sparse. One option that the author have presented in this paper is with the preoperative lymphocytography. The associated lymphatic abnormalities that might be presented with lymphocytography in lipedema patients include various varieties. Comes to the management approach for patients with lipedema. Trial of conservative management is really crucial for those patients, especially when lymphocytography shows abnormalities or variation in lymphatic distribution. This abnormality or variation might be related to the fluid overload in the limbs of lipedema patients. And the author have presented clearly that conservative management was essential and integral part of their approach. However, it is essential to be safe when delivering the suction-assisted lipectomy for those patients. There are different ways that has been presented to minimize or to prevent the associated lymphatic damage, as what the author have presented, some of which is going into deep liposuction. This is one option. The other option that also worth mentioning is doing a longitudinal liposuction. The third option is using a small caliber cannulas. What I would add also is, as a lymphedema surgeon, doing an ICG lymphography and mapping the lymphatic vessels will be also helpful to map the lymphatics and avoid them or be careful when doing liposuction nearby the main bundles coming out from the foot. Follow Feras Global Open Face the Case for more insightful and groundbreaking case reports. Thank you so much.